You're listening to Razorcast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
Hello, everyone. This is Liz Harvey coming to you from our Razorcast studios in New York City, where we are dedicated to bringing you top-quality advice from many of the leading expert professionals across the U.S. In today's episode, we are speaking with Dr. John Vitale. Dr. Vitale is the founder of Dr. John R Vitale, DMD, at Port Liberté, a general dentistry and cosmetic dentistry practice in Jersey City, New Jersey. He has an extensive dental background that began at Iona College and then at University of Medicine and Dentistry of New Jersey. Dr. Vitale has been practicing in the area for over 35 years and is currently a member of the International Congress of Implantology. He is also certified in Botox and dermal fillers, and he continues his education in the dental field with monthly classes. Dr. Vitale has also had the pleasure of traveling to Honduras and Panama to provide charity dental care to needy patients. Dr. Vitale is widely considered to be one of the top dentists in the country, and he is also a contributing member of our National Network of Industry Professionals. Today, we are going to talk about a very important topic: transforming a smile with cosmetic dentistry, bonding, implants, veneers, and whitening. Hi, Dr. Vitale. How are you today?
I'm fine, thank you. How are you?
I'm great. So thanks for being with us, and let's get started. First question, what types of dental procedures are considered cosmetic dentistry?
Well, I think you can classify any procedure which changes a person's appearance or the color of their teeth, or the shapes of their teeth. I think they would all be considered cosmetic procedures.
Okay.
And they have different subcategories also.
Okay, so one of the subcategories, I think, is teeth whitening. Is teeth whitening for everyone, or are there people that, it won't work for?
Teeth whitening generally is for most of the population, but not for everyone. I think older adults in their probably late 50s, 60s, and 70s who have a certain kind of tooth, a dense tooth with a dark second layer, generally those teeth do not whiten very nicely. But for the vast majority of people, dental whitening provides a very acceptable and cosmetic result.
Okay, and with regard to age groups, what age do people start whitening? I mean, do you see teenagers coming in to get teeth whitening, or do you recommend it mostly for, maybe college-age kids, adults? What do you think about that?
I think in my vast experience doing this, most people who come into the office are generally young adults, starting at age 18 and going upwards into their late 40s and early 50s. And I think a lot of women in their 20s and 30s, especially those getting married, for instance,
right.
They're usually our prime candidates for
right.
dental whitening in the office.
Okay, that makes sense. And, supermodels and other people
Absolutely.
like that too, probably. All right. And now to move on to another form of cosmetic dentistry, what are the advantages and disadvantages of dental bonding?
Well, the advantages of dental bonding are as follows. Number one, it's a quick fix because you generally can acquire the results that you want in one visit, and it's generally done chairside. So when a person leaves your office, their appearance is fixed, whether it be by changing the color of the tooth, by changing the size of a tooth. The disadvantages, they don't last as long as veneers do. A composite resin is used for a dental bonding procedure, and a composite resin is composed of ground-up glass beads and a resin matrix. And we put an etch and a bond on the tooth, and then we apply this material and hit it with a light and shape it and polish it, and you're on your way. But it picks up stains over a period of time because it is not as dense as a veneer. A veneer is a material that's made of porcelain, and it's baked in a kiln like you would bake a piece of pottery. And so the end result is a colored piece of glass, so to speak. So if you stain it, you just buff it up, and it comes back to normal, and it looks the same 10 years later as it looks the day it was placed. And that's the big difference.
Okay. And as far as veneers go, what types of problems do dental veneers fix? Why would someone need to get a dental veneer? And can you talk about what it is again?
Well, a dental veneer is a permanent placement of a porcelain material that's manufactured or made in a laboratory. It's fired up in a kiln at about 1650 degrees, and your end result is a piece of porcelain that goes over the front of your tooth and very little of the back of your tooth. It's bonded on, and it's a permanent restoration. The things that dental veneers fix primarily are, number one, tooth color. Some people, in years past, their moms may have had antibiotics when they were in utero, and as a result, they end up with what we call tetracycline staining on their teeth, which is a discoloration of the tooth, and no whitening or no composite resin is going to fix that type of a problem. So with that particular, in that particular instance, you need a permanent fix, something that's manufactured in a laboratory and permanently bonded to your teeth. Other things that veneers do, they change the shape of your teeth, they change the size of your teeth, and they can be used to close spaces in your mouth and change your aesthetics. It's a very permanent, very nice, and thorough form of cosmetic dentistry.
Okay, that's a lot of great information. And another question on that: how long does it take for a procedure, and does it depend on how many? Can you do one tooth, two or three? How typically when someone goes in to get dental veneers, do they fix more than one tooth, and how long is that process?
That's a very good question. Generally, when a dentist does veneers in a person's mouth, they do all the veneers that are necessary at that visit, and I'll tell you why. Mm-hmm. Because when you paint your house, for instance, if you paint one wall and you run out of paint, and you go back to the Home Depot and you order the same paint, well, when you put it on the next wall, it may not be exactly the same shade as the first layer of paint that you put on before. So when we're doing veneers, we like to have the laboratory technician use the same batch of material for the entire mouth. So when we end up with a finished product, your front teeth all look the way they should look, and they won't have any variation in color. If you do one tooth and send it to the lab and place the veneer at shade A1, for instance, and then 2 weeks later come back and try another tooth, it may not be the exact same A1. And so we like to do all of them in one visit. Now, I've done as many as 12 veneers in one visit of preparation. Okay. After that, an impression is taken. It's sent out to the laboratory. The veneers are fabricated, and then at the next visit, the veneers are tried in. We wait for patient approval, and once the patient approves of the way they look, we bond them all in. So to answer your question, it's 2 visits to generally do the veneers.
Wow, and it sounds really thorough, and thanks for all that extra information. I appreciate that. And then lastly, we're going to talk about dentures and implants. Why do people choose dentures over a dental implant? It seems like a permanent implant would be a lot easier, but are implants for everyone? And can you talk about that?
Yes, I could. Why do people choose dentures over dental implants? Probably for 2 reasons. The primary reason would be for finances, because dentures are not nearly as expensive to do as dental implants. However, the second reason is fear of the unknown. People generally, if they don't understand what they're getting, they're fearful of it. Or if they hear something from somebody about a procedure and they don't fully understand it, they tend to shun it. They know what a denture is. They're not that informed about what a dental implant is. The reality of it is that dental implants with dentures are so much better and longer lasting and satisfying for the patient and the dentist, because you literally, as a patient, after you have your dental implants and dentures placed, you can eat corn on the cob. You can cut a steak and eat it. You can't do that with dentures. No matter how good they are, they have their shortcomings, where dental implants much nicer restoration, and we do a lot of them.
Great. And is it mostly for older patients, or do you find, I know some athletes that lose their teeth sometimes get the dentures versus the implants because they just figure they're going to lose another tooth. I'm not sure. What can you say about the typical patient?
Well, when we're talking about the typical patient, adults age 60 and over, for instance, I think in our country, over 3 out of 5 are in dentures, full dentures. That's a staggering number or percentage of people who have no teeth.
Wow.
So, for those people, this is a tremendous area for them to really explore and take advantage of, because the end results is so satisfying. Now, for athletes and maybe younger people who have a lot of their teeth in their mouth but are missing just a couple, well, then you can do a dental implant, but the procedure that would follow that would not be so much a denture, but rather a crown, or a dental implant crown that would go over the implant. But to answer your question, the older adults, usually with no teeth or severe periodontal disease, end up with either dentures or implant dentures.
Okay, great. Well, thank you so much, Dr. Vitale. We really do appreciate all of this information about cosmetic dentistry, so thanks so much.
You're welcome so much. It was a pleasure.
Great. And for our listeners across the country, if you are interested in speaking with Dr. John Vitale, you can either go online to www.drjohnrvitale.com or call 201-521-9800 to schedule an appointment. And on behalf of our entire team at Razorcast, we want to thank you for listening, and we look forward to bringing you more top-quality content from our country's leading industry professionals.
You've been listening to Razorcast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.